Thank you very much, Professor Krohn. Thank you, Prof. Xavier Sheikh, and organizing committee for this kind invitation to participate in the forum. We go from China to South Korea, 50 million, Hong Kong, 7.5 million, to Singapore. We're just over 5.5 million, and, I was talking with friends from Qatar yesterday, and I was delighted to hear they're 2.6 million. And so, right, we're really pleased to share with you our priorities and strategies for workforce development. We might be small, but we face not dissimilar challenges in healthcare. Changing demographics, we're really aging very quickly, so you can see how that changes. We've been very successful in increasing life expectancy, and so now our life expectancy is at almost 83, now almost 84. By 2030, 1 in 5 from 1 in 9 now will be age 65 and above. And by 2030, for every 0.7 resident joining the workforce, for every 1 resident who's exiting. So you can see that's really dire statistics when you look at the healthcare system. Our numbers are tiny compared to China, but they're huge for us. We need 30,000 more healthcare workers by 2020. We're opening new hospital beds, community healthcare clinics, and these are huge challenges. The healthcare leadership, together with the Ministry of Health, charted 3 major shifts for a future-ready healthcare system, going from healthcare to health, and moving from hospital to community, and moving beyond quality to value. And so how does workforce development change, adapt to the future challenges? And in the time that I have, I'm going to just focus on 4 areas. The structure that supports and enhances the progression. Secondly, organizational culture and systems that will attract and grow the healthcare workforce to meet the service needs. The third area, recruitment and retention of talents. And the fourth one, training and development. So, a structure is critical to attract the right people into the healthcare system. In Singapore, and I think it's not unique in Singapore, but we have a healthcare system that's very traditional, hard to change. So future challenges requires an adaptable workforce. But our healthcare system is steeped in tradition. So we did several things to transform the way we think. One of them was really a very close partnership with Duke and US. And I want to say Professor Victor Chow was critical in making this successful. Duke came to Singapore actually not so long ago, just over 10 years. But absolutely transformative in the way we think, in the way we approach the future challenges. The unstinting support from Duke Durham was critical, I think, in the success. And certainly the leadership support from Dr. Chow was absolutely the pin on which this rested. So, that changed the culture to one that was more future-focused, focusing on innovations in healthcare, in education of the workforce, making this a priority beyond service delivery, which was already, a tradition within SingHealth. SingHealth, comprises 11 institutions with rich history Singapore General Hospital is the flagship of Singapore, 197 years old. KK Women's and Children's Hospital, 159 years old. So you can imagine the very strong organizational culture within these institutions and how strong these silos were. You put them together in a cluster, SingHealth, which spans from primary care, secondary, tertiary, quaternary, to the intermediate and long-term care. And you say, create a system that is seamless for patients and meets our future healthcare needs. You can't do it when 11 institutions have a strong silo. So what we did, which was very courageous, some might say foolish, but it worked. A 3-year endeavor of bringing all the physicians into central employment. And that allowed it to be an interlinked network of clinicians, putting patients at the center of this entire organization. We launched, SingHealth Academy, which worked closely with Duke NUS to focus on training and developing our people for the future. There's a whole session on technology tomorrow, but I want to say that technology is one of the key structures that need to be put in place. We worked then on the culture and systems, developed new, innovative models of care that were relevant to the present and to the future. Like many other countries, we need to push, towards primary care. So we developed, the regional health system. We weren't familiar with the community. We're largely trained and familiar with acute systems, acute hospital systems. But now we're looking and working with the community to ensure that smooth flow of patients back home. That's where our patients want to be. And we need to create support systems that keep patients at home. We created a new group of nurses trained to do just that, called patient navigators. In terms of tertiary care, we brought specialists from multiple institutions. We brought multiple domains together to create SingHealth Duke NUS disease centers, which are integrated practice units, ensuring that there were high standards of care in spite of the gateway by which patients come to us. So one example, the breast center, we had 4 different institutions giving breast care. We brought them all together within this virtual institute care center, which would standardize protocols, bring together multi-domains, so doctors, nurses, specialists from all different areas, allied health professionals in these centers, and in a way continue to break down the silos that were barriers to being future ready for what the country needed. We also put a big focus on leadership capacities, so developed several signature programs to develop our staff and put focus on mentoring, launched a College of Healthcare Administration and Leadership because we need the right leaders to guide us into the future. Recruitment, real focus on bringing in the right people, encouraging mid-career entrants, redesign jobs, a lot of need of technology in redesigning jobs because we're going to have fewer warm bodies in the healthcare system and greater challenges. And we looked at, extending employment beyond retirement age, retraining of nurses, etc. Recruitment and retention of talents. So we worked very hard on career pathways and enhanced competency development frameworks. We do a biannual employee engagement. We're constantly trying to be best employer. That's how you retain your talents. So we take it very seriously, that survey, various platforms for recognition and celebrations of achievements. And whatever you do, you've got to pay people right. So, there's some focus on that as well. And then building, future skills in SingHealth. So constantly looking at what we need to invent, reinvent, make relevant. A great focus now on family physicians as well, and advanced practice nurses, and various other areas where we look to strengthen the skills of our people. So with that, I thank you.